I grew up in a single parent home. It was five of us, all girls, and my grandma, she helped raise us. She helped my mom anytime she could.
It's wrong to ask seniors to pay more for Medicare just so millionaires and billionaires can pay less in taxes. That's not the way to reduce the deficit. We shouldn't be squeezing more money out of seniors who are just barely getting by right now. My plan is to squeeze more money out of the healthcare system by eliminating waste and going after abuse and fraud in Medicare. We can cut back government spending that we can't afford. But I will also ask anybody who's making over $250,000 a year to just go back to the rates they were paying under Bill Clinton, because, by the way, that worked.
It's very important to me and my family that my grandma gets the best of care, health care, and otherwise to have the most quality of life, when you get older. After you've worked so hard, my grandma worked 30 years at the post office.
The idea, which was originally presented by Congressman Ryan, your running mate, is that we would give a voucher to seniors, and they could go out in the private marketplace and buy their own health insurance. The problem is that because the voucher wouldn't necessarily keep up with healthcare inflation, it was estimated that this would cost the average senior about $6,000 a year. Now, in fairness, what Governor Romney has now said is he'll maintain traditional Medicare alongside it. But there's still a problem, because what happens is those insurance companies are pretty clever at figuring out who are the younger and healthier seniors. They recruit them, leaving the older, sicker seniors in Medicare. And every healthcare economist who looks at it says over time what will happen is the traditional Medicare system will collapse. And then what you've got is folks like my grandmother at the mercy of the private insurance system, precisely at the time when they are most in need of decent health care. So I don't think vouchers are the right way to go.
On October the 1st, my grandma fell and she broke her hip. Her insurance had just kicked in on September the 1st, thanks to the Obamacare drive. And she was able to get the most optimal care. At one point, we thought that we would lose my grandma, but they did more. They tried to help her more, and I think the coverage is what made them work harder.
Medicare. It's not about overheated rhetoric at election time. It's about a promise this country made to our seniors that says if you put in a lifetime of hard work, you shouldn't lose your home or your life savings just because you get sick. Over the last 47 years, millions of Americans have worked for that promise. They've earned it. And for many seniors, the care they've gotten through Medicare has made all the difference in the world. Growing up as the son of a single mom, I was raised with the help of my grandparents. So I saw how important things like Medicare and Social Security were in their lives. And I saw the peace of mind it gave them. That's why, as president, my goal has been to strengthen these programs now and preserve them for future generations. Because today's seniors deserve that same peace of mind. And the millions of Americans who are working hard right now deserve to know that the care they need will be available when they need it. That's why, as part of the Affordable Care Act, we gave seniors deeper discounts on prescription drugs and made sure preventive care like mammograms are free without a copay. We've extended the life of Medicare by almost a decade, and I've proposed reforms that will save Medicare money by getting rid of wasteful spending in the healthcare system and reining in insurance companies. Reforms that won't touch your guaranteed Medicare benefits, not by a single dime.
Hi, my name is Dominique Deering. I'm a middle class single parent and I'm a future leader of tomorrow. And yes, I approve this message.